One of the reasons why we have to do so much testing is there's so many things that can cause a hearing loss. You can be born with it. You can inherit it from your parents. You can have damage to your ear that can do it. Chemotherapy can do it. Diabetes can do it. A blow to the head can do it. A bacterial or viral infection can do it. And for a lot of us, it's noise, and that's becoming an increasingly bigger problem, especially with young people, because the earbuds play such pure sound that you're tempted to turn them up too loud, and they think up to 30% of young people have a hearing problem already. Okay, so besides all those other things, now I deal mostly with a geriatric clientele, but just getting older can affect your hearing too. And for some people, it's more than one thing. So we do a battery of tests so we can find out exactly what we think is causing the hearing loss. Sometimes I have to refer somebody to an ENT for medical treatment. So there's all these different things that can affect somebody's hearing, and we test to find out what causes it. And then we know what's the best way to treat it. Well, it depends. You can have what we call a conductive loss, and that's caused by a breakdown in the system that brings the sound into our ears. Could be the eardrum is stiff. It could have a hole in it. It could be the little tiny bones in our ears are disconnected. It could be fluid in the inner ear that keeps them from moving as they should. That's called a conductive loss. We're able normally to treat that with a doctor. If the loss is inside the cochlea, it's more of a sensory neural loss, and that's caused by damage to the fine hair cells inside the cochlea that we hear with. And they get damaged from a variety of different things. Noise is one of the big ones. But ototoxic chemicals is another thing. There are a lot of things. Even aspirin, taking a lot of aspirin can damage those hair cells. Once they get damaged, they don't work very well anymore. And as a side effect of the damage, you can get something called tinnitus, which is commonly referred to as a ringing in the ears. And that's the hair cells in your ears constantly sending a message to the brain that they're hearing something. Now, I've had it since I was in the Army 40 years ago, and it's a high-pitched mosquito whine in my ears. But it can be a lot of different sounds. Some people don't have too much trouble with it, and I'm one of them. Some people, it affects them drastically, and in a few cases, it has even caused people to kill themselves because it was so loud and so disruptive for them.
People.
Well, the number one thing we can do is getting the correct instruments to hear with, for one thing. But we also have to realize that once people get hearing aids, they are not a miracle. You can never get back the hearing you had before you lost it. And so what you have to realize is even though they have help for hearing aids are not perfect. You're always going to do best when you face somebody, when you talk to them. You want to make sure you have their attention before you ask them a question. That's just being polite, but it will help you communicate with them the best. And everybody that loses their hearing learns to a certain extent or another to read lips. So by facing them, it really helps them get all the cues they need to hear you their best. Only about 10% of the people that have a hearing loss will do anything about it. And it's about 30% of the population. So there's an awful lot of people out there that have a problem that will never do anything about it, which is really bad because it isolates people socially. Yeah, it isolates them from their family. They can't hear the television. They get tired of asking people to repeat themselves, so they just stop and they kind of retreat into themselves. Johns Hopkins University did a study 2 years ago. People with a hearing loss are up to 5 times more likely to get dementia and Alzheimer's. That's a very serious thing because your brain's not getting all the information that it used to, and it actually starts to shut down some. It's not the main cause, but it is a contributing factor.